Palliative care in India is a term restricted only for use in the upper echelons of society. It is care for end of life of people who are suffering from a disease that cannot be cured and they're on their last journey. For most terminally ill patients, pain is part and parcel of the process of dying. It is very sad for the families that have to see their loved ones in pain. I remember a friend's mom came to me and said that nobody's mother should suffer the way her mother suffered with bone cancer. But the reality today is that we still have not solved the issue. India has restrictive use of opioids because of stringent laws on drug use. But we will have to find a resolution to this. But people like Dr. Rajagopal are not sitting back. They're taking the challenge head on. Democracy News Live spent time with him to understand the issues around palliative care and what needs to be done.
Currently, only say around 2% of the needy have access to pain relief or palliative care in our country. The major work that needs to be done is to improve the perception of the man on the street. This is not easy because people who have suffered usually have no voice. People who have suffered an injustice in terms of lack of pain relief, other elements of suffering, financial destruction, they have no voice. And when you are healthy, you usually do not want to think about ill health. It is not only for end-of-life care. Certainly end-of-life care is part of it. But imagine somebody, say, getting cancer, going through 2 years of treatment without pain relief, without any attention to how he feels or how his family is getting destroyed. As the World Health Organization says, palliative care has to be integrated into all health care. When somebody gets a health issue, that person's suffering also needs to be treated. You may not even find it easy to believe me when I say that even today, the medical student does not learn the fundamentals of modern pain management, that he doesn't know how to relieve the breathlessness of somebody with a cancer here. So that medical education has to happen. In-service education of professionals has to happen. In addition, there also needs to be palliative care units. An implementation framework for incorporation of palliative care in healthcare or in health education does not exist now. A framework has been created but not yet made part of the government plan. If we are able to convince the lawmakers and the officialdom about how important it is to treat the suffering, how will that political will be created? Only with public demand. In Kerala, the man on the street has heard of palliative care. He may have misconceptions. The average professional may have misconceptions. Often it is associated with only end-of-life care. But it is a known entity. It happened over many years. It happened over maybe at least the initial 15 years of efforts before Kerala government accepted it as a policy and incorporated into the government program, at least partially. And it succeeded because the common man was made part of the movement. The community was engaged and made part of the caregiving system. I am making a statement that today's healthcare is not healthcare. That may sound crazy, but officially, health is defined as not only absence of disease or infirmity, but as physical, social, and mental well-being. Is that what our healthcare institutions do? If you are going there with a cough, or with a pneumonia, or with a cancer, currently the focus is too much on diseases. Certainly, a focus on diseases is needed, along with a focus on the person's suffering.